Hello, I'm June.
I'm Jane.
Hi, Misha.
Today, our group will be presenting our community project on ADHD, depression, and anxiety in DMD patients and the importance of managing mental health in these patients specifically. We will be discussing 3 DMD patients and their experiences with ADHD, depression, or anxiety.
Let's begin with what DMD is. DMD stands for Duchenne muscular dystrophy, which is an X-linked muscle degenerative disease that associates with the most severe clinical symptoms of all the muscular dystrophies. Patients with this disease lack an essential structural protein that maintains the shape and functions of muscle cells, which is called dystrophin. Therefore, the muscle cells cannot be held in place and do their normal stretching and contracting functions. These muscle cells will degenerate and die, which will then be replaced by fat tissue and scar tissue in muscle bundles. The resultant symptoms in patients with DMD include walking difficulty, stiff joints, and progressive muscle weakness. And as the disease progresses, more systemic symptoms will appear. The progressive muscle degeneration will gradually result in loss of organ functions, including end-stage cardiorespiratory failure, which is the main cause of death among DMD patients. The prognosis survival rate of DMD patients is relatively high among 0 to 10 years old, but it decreases with age. Research data shows for every 1,000 patients 20 to 25 years of age, 86 will die each year, which increases to 336 each year for those older than 40. The pooled global DMD prevalence was estimated to be 0.0071% in males and 0.0028 in the general population. So what leads to DMD? DMD is caused by mutations in the dystrophin gene, which is a template for protein synthesis. The gene mutation results in the production of malfunctioning dystrophin proteins, which cause the muscle cells to collapse and degenerate. The disease is X-linked recessive, meaning that females with one disease allele are not affected by the symptoms. They are just healthy carriers. However, since males have only one copy of the X chromosome, inheriting the disease allele means inheriting DMD. Therefore, statistically, boys are more likely to get DMD compared to girls.
At infancy, patients with DMD's ability to walk, sit, stand, as well as their speech may be delayed. In their early childhood, they would have a more difficult time keeping up with their peers. Walking becomes increasingly difficult as the child ages and may require a scooter or wheelchair to assist them. DMD patients will eventually lose their independent ambulation by the age of 13, where they may heavily depend on a wheelchair or other support devices to carry on with their daily activities. With such a debilitating disease, patients with DMD, who are usually young boys, don't get to do as many physical activities as other boys their age. After loss of ambulation, the patient would experience cardiac, respiratory, and orthopedic complications. Their conditions will continue to worsen as their upper body function deteriorates by around 20 years old. Eventually, they experience respiratory and cardiac failures, which result in death. In this course, we have discussed a broad range of topics pertaining to DMD. This includes DMD's disease mechanism, physiology, pathology, genetics, clinical interventions, and therapeutics of DMD, and even some ethics pertaining to DMD clinical trials. We have discussed many ways we can physically improve DMD patient symptoms. However, we overlook the psychosocial aspect of DMD patients.
In this video, we hope to convey how mental health is an important aspect of all patients' experience with disease. This includes DMD patients who also experience a range of mental health difficulties, including ADHD, depression, and anxiety that negatively impact their quality of life. Having more emphasis on mental health care when incorporating interdisciplinary care for DMD patients could better enhance their quality of life and prevent possible and/or additional deterioration of physical, cardiac, and mental health. We will be focusing on ADHD, depression, and anxiety. We decided to look at these specifically because these three are some of the most prevalent factors in affecting an individual with DMD and their mental health. We will be examining in detail how these three factors can affect their mental health, highlighting the importance of mental health, and also provide some possible treatments that could manage and improve the mental health of an individual with DMD.
So why is mental health important? Why should we care about it, and how is it linked to our health? Mental health involves the state of our emotions, social well-being, and psychological well-being. This could have an impact on our feelings, thinking, actions, and mind. One's mental health can change over time, and it could affect a wide range of people at different stages of their life. Mental health influences how we function every day. If an individual has poor mental health, this could affect, for example, their sleep, eating, behavior, and thinking, eventually and potentially affecting their physical health. So it's important that we manage our mental health. According to the CDC, 1 in 5 US adults have mental illness, so it's relatively common in the general population. So what are the causes of mental health issues? There are many sorts of factors that are attributed to poor mental health. This could include adverse childhood experience, chronic medical conditions, biological factors or chemical imbalances in the brain, use of alcohol or drugs, and having feelings of loneliness or isolation.
We will now be discussing ADHD, depression, and anxiety in more detail, and how each of them affect DMD patients. We will be introducing our 3 DMD patients, Bob, David, and Max.
We mentioned previously that one of the factors that affects mental health is ADHD. But what exactly is ADHD and how does it affect mental health? ADHD stands for Attention Deficit Hyperactivity Disorder. It is a neurodevelopmental disorder characterized by persistent patterns of inattention, hyperactivity, and impulsivity that can significantly impact daily functioning. Children and adolescents with ADHD exhibit significant impairment and are at an increased risk of deficits in social, emotional, and educational development, which all ends up affecting the child's or adolescent's mental health. The boy on the wheelchair wearing an orange shirt is Bob, who is a 13-year-old boy diagnosed with both ADHD and DMD. So far, we have discussed ADHD and DMD individually, but how are these two connected? Research conducted in 2012 discovered that ADHD was found in 33 of the 103 boys with DMD. ADHD occurred more frequently in association with mutations predicted to affect DP140 expression, that is exon 45 to 55, and in those with mutations predicted to affect all dystrophin product, including DP71, that is those that have promoter region and specific first exon between exon 62 and 63, but were also relatively frequent. This figure from the same research shows each of the 103 patients with an area demonstrating the length of the mutation. The dots here represent patients with both ADHD and DMD. Another recent study conducted in 2022 focused on patients with DMD aged 5 to 18 years from Dr. Sarjito Hospital and Universitas Gadjah Mada Academic Hospital from 2017 to 2022 in Indonesia. The results of the study indicated that the mean total IQ score of DMD patients was lower than that of the general population. This leads to the conclusion that boys with DMD are at a higher risk of intellectual disability. The risk appears to increase if mutations at the 3' end of the gene DP71 disruption. Well, what does all of this mean for Bob? The results from previous research suggest that ADHD is a frequent feature in DMD. The risk of ADHD appears to be higher in patients carrying mutations predicted to affect dystrophin isoforms such as DP140, which is expressed in the brain and are known to be associated with higher risk of cognitive impairment. This means that in Bob's case, the exon mutations that led to ADHD and DMD must have an overlap, which puts Bob at a higher risk of being diagnosed with ADHD and eventually resulting in both mental and physical disabilities. From past findings about the connection between ADHD and DMD, we can conclude that ADHD can affect DMD patients, but not the other way around, implying that DMD does not necessarily affect ADHD patients per se. ADHD is the most common neurobehavioral comorbidity of DMD. We can also make some general conclusions about what Bob, as a DMD patient with ADHD, experiences. Bob can have psychosocial problems such as depression and/or anxiety, which we will be discussing later on in this video. These problems may lead to social isolation and withdrawal, pushing the patient, or Bob in this case, into depression. We have discussed DMD, ADHD, and how having both can have a lasting effect on Bob. The question that arises is, what now? Well, the use of short-acting methylphenidate can be clinically effective for learning problems in not only Bob, but in other boys with DMD and ADHD. Another way to help Bob can be support groups for patients with similar, if not same, diseases and issues, because knowing that you are not alone and getting support from others can be very empowering for Bob. But at the same time, if mental health is not properly taken into account, then patients with DMD or both DMD and ADHD, like Bob, can easily fall into depression by feeling alone and tending to have withdrawals where they isolate themselves.
Let's hear the experience from David. David is a 13-year-old boy in middle school, and he was diagnosed with DMD at the age of 7. Over time, he developed depression due to his physical symptoms. He was no longer interested in playing games and watching movies, which were activities that he loved to do every day. He felt sad and numb every day and was not willing to get up from his bed. His family was at a loss for what to do for David and his depression. So what is the definition of depression? Depression is defined as an extremely depressed mood state that lasts at least 2 weeks and includes cognitive symptoms such as feelings of worthlessness and indecisiveness, and disturbed physical functions such as altered sleeping patterns to the point that even the slightest activity or movement requires an overwhelming effort. Depression is a common mental health issue related to DMD. A study in 2016 reported that among half of the male patients having neurobehavioral issues, 51% had a depressed mood. In DMD patients, immobility was one of the major causative factors for the depressed mood in these individuals, especially for older patients who have developed more severe symptoms compared to younger patients. Patients with depression would become less willing to move around and maintain their muscle strength, which will contribute to a faster progression of the symptoms. Another study conducted in 2014 concluded that patients with muscular dystrophy are commonly afflicted with psychological disorders like depression, anxiety, cognitive deficits, and these mental disorders are likely to exacerbate disease progression and worsen their quality of life. Therefore, extensive care on patients' mental health is also important, despite the current multidisciplinary care on physical health of DMD patients. Family consulting is highly recommended to families with a DMD family member, so any mental problems can be discovered and addressed as early as possible. Treatments for depression include behavioral therapy, antidepressant drugs, and cognitive therapies, and it's important to treat both DMD and stress disorders for patients with muscular dystrophy, which can be done by support groups, medications, and creating a unique curated treatment for these patients. For David, he did cognitive behavioral therapy to deal with his depression before his condition became worse. And this really helped improve David's mental health since he's able to pick up his interest and energy again after a few rounds of visits to his psychologist. Stress disorders are not limited to just ADHD or depression. Anxiety is another major disorder that DMD patients can experience.
People with anxiety, which is a feeling of worry and unease, can have mild symptoms where they may feel uneasy at times. However, this anxiety can also be persistent, which hinders people from carrying out their daily tasks and prevents them from full participation in life. This can lead to more frequent panic attacks, where a person, when experiencing intense anxiety, can have a faster heart rate, shortness of breath, or trembles. There was a study done that looked at the prevalence of significant anxiety and depression symptoms in DMD populations and the difference in the reports from the patients and their parents or caregivers. Through questionnaires such as the Screen for Child Anxiety-Related Disorders, which is the gold standard for screening anxiety, it was found that higher anxiety symptoms were more prevalent in DMD patients than the general pediatric population. About 25% of the patients rated themselves with high levels of anxiety symptoms compared to the 15% of the general pediatric population. Now let's meet Max. Max, who has Duchenne, was a sophomore in high school. He developed bad anxiety and frequent anxiety attacks due to feelings of worry and unease about his condition. He has trouble sleeping, and there was tension, stress, and exhaustion in his household as his anxiety seemed to worsen. Psychological stress disorders like anxiety arise with and are prevalent due to the physical and social hardships that come with diseases like DMD. This can have an impact on Max's mental and physical health, worsening his quality of life. Based on some studies, there seems to be a link between psychological stress in muscular dystrophy and increased cardiac risk. There is also an association of autonomic dysregulation with muscular dystrophy and behavioral disorders, where more psychological stress can lead to irregular heart rates and muscular dystrophy, which could result in death. DMD is a progressive degenerative muscle disease, so any more damage to their muscles will just worsen their condition. While much of research has been focused on improving muscle function and structure in DMD patients, it is important to treat stress disorders like anxiety in order to not make a patient's condition even worse for a better therapeutic outcome for people like Max. Psychosocial care is essential for DMD patients who have symptoms of anxiety and/or depression, especially for their quality of life. There is a therapy called neurofeedback that can help to alleviate anxiety and panic attacks in DMD patients. Neurofeedback is a conditioning procedure that works to improve functional activity of the brain. This is done by taking an electroencephalogram or EEG of a patient to measure their brainwave activity. A computer program will analyze this activity and generate feedback to the patient's brain that will condition the brain to produce new electrical activity habits. One study tested this therapy out in 2 DMD patients and 1 patient with muscular dystrophy of an unknown etiology, all with panic disorder, and showed alleviation of their panic disorders. While this study was relatively small and still needs to be further studied, this could be a potential and safe therapy alternative with minimal side effects and also does not require the use of drugs for DMD patients with anxiety. FDA-approved medications to treat anxiety disorders are also available. Antidepressants are often used to treat anxiety. This includes medications from the selective serotonin reuptake inhibitor class. These medications do not work instantly, and they do have small side effects, but they're generally effective. Relaxation techniques are also an option for mild anxiety to help a person calm down. There are many resources such as books, online material, and apps that help provide simple relaxation exercises or tips to alleviate anxiety. Mental health professionals like psychologists are also a resource that DMD patients experiencing anxiety can utilize for a more personal and direct approach. Realizing there were many resources for his anxiety, Max decided to see a psychologist once a week who was able to provide for his needs, and he experienced less anxiety attacks after a year. He was doing much better mentally. He and his family really noticed the positive effects of seeing a psychologist, and they even recommended parents in a similar position to find support and resources for their children with DMD and anxiety. This is just one of the many ways a DMD patient could navigate through their anxiety, but there are many more resources out there that can help with it.
Psychosocial management and managing mental health is an important aspect for everyone, including patients with DMD. It is sometimes easy to overlook mental health when there is a lot of emphasis on trying to find more effective therapies, drugs, and treatments to physically treat DMD patients. Yet mental health care for these patients is just as important to the other types of care they receive. As mentioned before when discussing ADHD, depression, and anxiety, there are multiple ways to manage an individual's mental health. This could be through therapy, medications, support groups, and online resources that individuals experiencing ADHD, depression, or anxiety can utilize.
Interdisciplinary care should be the approach used when treating DMD patients due to the many areas of the patients that DMD affects. Some therapeutic approaches such as the use of corticosteroids, immunosuppressive agents, utrophin, gene therapy, and stem cell therapy have attempted to alleviate the physical limitations that come with DMD. This includes approaches that can help with increasing social interactions or managing anxiety, depression, ADHD through individual, group, or family psychotherapy and educational programs. DMD is not just a physically debilitating disease, but it also affects a person's well-being. Not only should the patients seek psychosocial support, their families should as well, as part of a holistic therapeutic approach. Psychiatry is a necessary aspect of holistic treatment for DMD patients, and that psychiatric care should be considered and emphasized more upon DMD diagnosis.
Here is a list of references we used for contents and images in this video. Thank you for listening.